My health insurance is $680 a month.
What?
Mine's like double that.
What?
That's pretty standard.
And then that covers, like, then everything is free, or?
Oh no, I still have
No.
copays.
No,
Yeah, no.
it doesn't. It actually covers almost nothing. I'm actually thinking of switching to having no health care.
Yeah, because it's cheaper to not go through insurance for a lot of healthcare costs.
No. US versus Canada healthcare. Which one would you choose?
Canadian healthcare.
Is there a reason?
Yeah, it's free. It's like, it's funny because like my American friends don't get it. They hear the horror stories.
Yeah.
And there are some bad things about, look, if I had unlimited money, maybe the American one's pretty good, but
Yes.
then that kind of defeats the purpose.
That's right.
I love being able to walk in with a card. It doesn't matter if I have a sniffle or a gunshot wound.
Right.
One card, will you fix me? And they're like, yes, come in.
Sure.
In 2026, the United States is still the only developed country on earth without universal healthcare, and Canadians on the internet keep accidentally making that impossible to ignore just by describing their lives.
Tell me why I tried to apply for health insurance as a new resident in the US and now my phone thinks I signed up for a reality show. I'm not even exaggerating. I filled out one form and suddenly my phone is blowing up. Calls, texts, voicemails. Like, relax, I'm not going anywhere. And coming from Canada, this is actually shocking. In Canada, you don't get 25 calls in one day just because you wanted health coverage. You just have it. Quite simple and no one's chasing you down. Here, it feels like I entered a competition. Who can call me first? Who can sell me faster? And the craziest part, it's expensive. Like, you're paying every month and you still have to think twice before going to the doctor.
The ways that people like interact with the healthcare system here in America versus Canada, where I grew up, is so different. Like, my family, if someone coughed, we would go make an appointment with our PCP. But over here, it seems like a lot of people don't have PCPs. Whenever they're going to the doctor, like, they will wait till they're about to die. Because preventative medicine here is almost like non-existent. Like, a lot of people are so scared. Like, they'll go in for their the annual checkups that they do, where they're like, okay, we're gonna do this screening, everything's free. But then all the tests that you have to do after that are so expensive, and like medications are so expensive. Canada, it's a completely different story. Like, people over there, like, we are so much about care. Like, of course we have like long wait times and a bunch of little things that come with having universal healthcare, but we do not worry about paying a bill the same way people do here.
When I tell you guys I'm proud to be Canadian, here's why. I'm looking for a new dentist, right? So I call this place and I'm like, hey, do you guys have an appointment like soon? The first thing she's gonna ask me is, hey, what insurance do you have? Not even my name, my date of birth, where I'm from, what do I want, what kind of service I'm looking for. They want to know, how are they going to get paid? Canada could never. The US, seriously, healthcare in the US is strictly business. They do not care about the patient, how the patient is feeling. What they really care about is how are they gonna get every single penny that they can from you. I was so mad. I was like, you know what? Let me go to a clinic that actually cares about what I need to get done and, you know, who I am as a patient before asking me my insurance. So I told the lady, I said, well, do you not want to know, like, can I please at least know what you have available before I give you my insurance information? Because if you are going to give me an appointment in like 4 weeks, I don't want it, because I'm sick of them fillings that I have in my mouth. I want to put them all white so it could all match, you know, not silver, like it's old school. People will be like, oh, in Canada, yeah, it's free, but you still have to wait 10 hours to see a doctor. So what? I'd rather wait 10 hours than having to pay like $50,000 just to give birth. Does that make sense to you? Come on, let's be real. And if you are waiting 10 hours in Canada to get care, it's probably because you are at the hospital for something that is not critical. Like, you will not expire in the next like 2 minutes, you know what I'm saying? So it's free, you know. So obviously, if it's not something that requires medical attention immediately, you are going to wait a little bit. It kind of makes sense. And honestly, I believe that healthcare should be free. And the fact that everything costs in the US, like, people literally have to have, like, if you don't have good insurance, like, you are on your own. Really, that's what it is. You are on your own. So yeah, I'm like so sick of it. Like, the US, I'm telling y'all, you probably don't understand it now, girl, but being Canadian is a flex.
Different clips, same root problem. When coverage isn't guaranteed, an entire industry grows up around selling it to you, and that industry's incentives have nothing to do with your health. The dentist, the 25 calls, the avoided checkups, they're all downstream of the same decision the US made and every other developed country didn't.
I'm Canadian, and I had a very interesting experience with the US healthcare system a few days ago. I was in Florida and my toddler developed a very strange sounding cough. We found an urgent care, we walked in, we were seen within 20 minutes. We had travel insurance, but we were just going to pay out of pocket and then claim it later. And I was very interested to hear how much it was going to cost because we've all heard crazy things about how expensive US healthcare is. He was seen, treated, got a dose of steroids, and the entire thing cost $250 US. Now again, we're going to claim that on our insurance, so it's going to cost us $0. But had this happened at home and it was the weekend, our pediatrician would have been closed, so we would have had to go to the emergency room. We would have likely waited between 8 to 12 hours, and we would have been met with amazing doctors and nurses, but amazing doctors and nurses who are tired and overrun with workload. We walked out of that urgent care and we were looking at each other and we're like, we've never met such relaxed healthcare professionals that had time to chat and to sit with us. Now, with that said, while we were in the waiting room for 20 minutes, another family came in and they couldn't afford the price of the treatment their child needed, and so they had to leave. So though my experience with the US healthcare system was exponentially better than my experience with Canadian healthcare, I still would go with Canadian healthcare for the sole reason that no one will have to leave because they can't afford it.
Hi, I'm pregnant and I'm about to deliver my baby.
Okay, welcome to our hospital. We will take care of you.
Thank you.
Now, congratulations on your baby. Now you can go home and enjoy your 12-month paid maternity leave.
I'm looking forward to it. Have a great day.
Good luck.
Bye. Hi, I'm about to deliver my baby.
Do you have health insurance?
I do.
Can I see your insurance card?
Sure. I'm about to pop, dude.
Let me check if insurance will cover. Yep. Unfortunately, we're out of network. I have to go to the other hospital on the other side of town.
You've got to be shitting me.
Go. Bye. Hello. How can I help you?
Hi, good evening. I'm about to have my baby.
Okay. Do you have health insurance?
Yes, I do.
Let me take a look at your card. Let me check if we're in network.
I hope so. The last hospital didn't take me.
Yeah, we're in network. Do you want epidural or not?
Yeah, I want an epidural.
Okay, so with epidural, it will be $1,700 copay, but you have to pay before we admit you to the hospital.
But I don't think it's $1,700.
Yeah, that's how much the insurance covers. So with the copay, it's $1,700. You want to pay with a credit card, or you want to go and find a different hospital that will do it cheaper?
No, I guess I'll pay.
Okay, here you can just, it's going to ask you a question if you want to tip 15 or 20%, and you can just tap to pay.
Are you kidding me?
It's not mandatory. You don't have to.
I'm not.
Okay, that's fine.
The Florida story and the delivery room skit are two sides of the same coin. One real, one satire, both accurate. When a tip screen appears after an epidural, the joke writes itself.
I am an American on a tourist visa here in Canada, Calgary, Alberta to be exact. And I see a nurse practitioner here because I am going through perimenopause and all that stuff. And so she ordered a transvaginal ultrasound. Now, I get these ultrasounds several times a year back in the States. I know what they cost with insurance. Usually runs me over $1,000 for my, what I owe after the insurance pays. I called today to schedule, and not only were they able to get me in tomorrow, but it is only going to cost me like $139. $139 out of pocket. When I called up, they're like, "You sure you don't have Alberta healthcare? You don't have Alberta's healthcare?" I was like, "No, unfortunately I don't, And she's like, "Okay." Right within seconds, she was able to give me the how much I'm going to have to pay out of pocket. She said, "Hey, credit card, debit, however you want to pay." Such a relief. Quick scheduling, friendly people on the phone, people that sound like they love their jobs or just value doing what they do, and not having to pay an arm and a leg. Amazing.
She's not even a Canadian resident. She's a tourist, and she still paid $139 for a procedure that cost her over $1,000 at home with insurance. Let that sit.
Why don't I just go to the US and make more money as a heart surgeon? It's a valid question. On the high end in the US, you can make much more than you can as a physician in Canada. But money ain't everything. Number one, I was born and raised here. The community raised me. The medical system trained me for decades. I feel like I owe to provide cardiac care, surgical care to the community of this city. Number two, there's a lot of advantages of being a heart surgeon right here in Canada. I don't have to worry about too much administrative burden. Whether the patient has money or not, do they live on the Bridle Path or do they live in Scarborough, whether they have insurance or not insurance, it doesn't matter that much. I'm going to provide you with the same top level of care that I can provide. Number three, there's less medical legal pressures as opposed to a more litigious society like the US. Number four, our hospitals are mostly public institutions. They're not private organizations. I can be a doctor. I can just think about the patient. I don't have to also be a businessman. And I've seen that pressure in New York and in Washington where I trained. I also love the great city that I live in, Toronto. We have a tremendously diverse population. So despite being in the first world, I get to see diseases of the third world and the first world right in our communities. I get to be a heart surgeon. I'm well compensated. I get to care for the community. What's that worth? To me, it's priceless.
Let's start with the surgeon, because his answer is the one that should make Americans the most uncomfortable. He had the credentials, the training from top institutions, and the offers to match. He walked away from significantly more money. And his reason was that in Canada, he doesn't have to think about whether a patient can pay before he decides how to treat them. He looks at the person in front of him and just does the job. He said it himself. He doesn't have to also be a businessman. That sentence sounds simple, but think about what it means in practice. Every physician operating inside the American system has to hold two jobs simultaneously, healer and revenue generator. Those two roles are not always in conflict, but when they are, the system has already decided which one wins. And that pressure doesn't stay in the operating room. It flows downstream into every layer of the system. It's in the receptionist asking for your insurance before your name. It's in the specialist who orders the tests that are billable over the ones that are necessary. It's in the hospital that routes you to a more expensive procedure because the margin is better. None of these people are villains. They are working inside a structure that rewards certain behaviors and punishes others. The structure is the problem.
This is an incredible chart that unintentionally explains what the heck is wrong with America. And this chart isn't even trying to attack America. They're just talking about NATO spending as a percentage of the overall economic output, also known as GDP. So it covers military spending, health spending, and education spending, again, as a percentage of gross domestic product. Seems harmless, right? Let's take a look. Let's start with good old Poland, NATO's most trustworthy partner. All right, they spent 4.1% of their GDP on the military in 2024, and they're going to ramp it up to 5% this year. Great. All right, 7% of their GDP on health. All right, that sounds pretty high. And just under 5% on education. All right, that's just under what the US does. We do 5.4%. Estonia, good for them. They spend even more on their education as a percentage of GDP than Poland. Wonderful. Now let's look at the United States.
Here's a little graph of the healthcare administration costs by country. There's Japan at the lowest, UK, Sweden, South Korea. The average is 100, whatever. Here's the US.
Now let's talk about the data, because this conversation often gets reduced to feelings, and the numbers deserve more attention than they get. The US spends roughly $13,000 per person on healthcare every year. That is more than any country on the planet. Canada spends about half of that. The UK spends about a third. And yet, by almost every population level health metric, life expectancy, maternal mortality, infant mortality, management of chronic disease, the US ranks below most of the countries it's outspending. You are not getting a premium product for a premium price. You are paying the most and sitting in the middle of the pack. Or worse, that should be the headline every single day. It really is. The wait time argument, let's handle it properly because it comes up every time. Canada has wait times. That is true, and it is a legitimate criticism of the system, particularly for elective procedures and specialist referrals. But here's what always gets left out of that argument. Americans wait too. They wait in a different way and for a different reason, but they wait. They wait because they're doing the math on whether they can afford to go at all. They delay the lamp they found. They manage the chest pain with ibuprofen. They look up their symptoms online and hope for the best because a single ER visit can generate a bill that takes years to pay off. That is not a functioning alternative to wait times. That is a hidden wait time dressed up as personal responsibility. The other thing worth noting about wait times is where they come from. Canada's wait times are in large part a resource and funding issue, not a structural flaw in the model itself. Countries like Germany, France, and Australia have universal systems with dramatically shorter wait times than Canada because they've invested more in capacity. The solution to Canadian wait times is more investment. The solution to American healthcare isn't more investment. It's a complete restructuring of who the system serves. Which brings us to the question that always gets avoided. If the current system produces worse outcomes at higher cost, why does it still exist? The answer is not complicated. The American healthcare industry, insurance companies, pharmaceutical manufacturers, hospital networks, and the lobbying infrastructure around all of them collectively spends hundreds of millions of dollars a year ensuring that the people who write healthcare legislation have a financial incentive to lead the system alone. And that's what makes a Canadian comparison so threatening to a certain kind of political argument. It's not a theoretical model. It's a real country sharing a border with the same standard of living, whose citizens do not go bankrupt giving birth, do not skip cancer screenings because of cost. The comparison is right there. It has always been right there. What's changed in 2026 is the visibility, and Americans are watching that and experiencing something that isn't quite anger. It's closer to grief. They are mourning what their own country has spent decades deciding it doesn't want to be. There's also a conversation worth having about what this costs beyond the individual. When people avoid preventative care because of cost, they don't just harm themselves. They show up later, sicker, more expensive to treat, and often on public programs that end up absorbing the bill anyway. The uninsured and underinsured don't disappear from the healthcare system. They just access it at the worst possible moment, at the highest possible cost, with the worst possible outcomes. A country that doesn't invest in keeping people healthy up front pays for it on the back end. It just pays in a way that's easier to ignore politically. Universal healthcare isn't charity. In pure economic terms, it's prevention at scale. And then there's what it does to people psychologically, which almost never gets discussed. Living in a country where a single medical event can financially destroy you changes how you move through the world. It makes people afraid of their own bodies. It creates a relationship with healthcare that is defined by avoidance, anxiety, and delay. That is not a normal way to live. Most people in Canada, the UK, Germany, Australia, they don't lie awake wondering whether they can afford to call an ambulance. That freedom is invincible until you don't have it. And once you've seen what it looks like to simply not have that fear, it's very hard to accept the alternative as inevitable.
Did you know that the United States is the only developed country in the entire world with private healthcare insurance and without a universal healthcare option? Yeah, we have Medicare, Medicaid, VA, but that only affects a percentage of the population, right? Now, conversely, Canada, I practiced in Canada for 11 years. Canada is the only developed country in the entire world that has a universal healthcare system, and you cannot have a private option. In fact, it's illegal. It's considered jumping the queue to have a private healthcare there.
So what do you all think? Do you think the US gets there in your lifetime? Because based on everything we just watched, the conversation is only getting louder. Let me know your thoughts down in the comment section. I would love to keep this discussion going. Otherwise, that's it from me. I also have another video specifically tailored for you. And if you enjoy such kind of content, please click up here and enjoy. Also, consider subscribing, liking and sharing because it helps me grow my channel and helps YouTube recommend this video to a wider audience. But for now, thank you so much for watching. And until the next time, the Joy Report out.